Your heart is trying to warn you, right now, tonight. While millions of Americans over 60 sleep peacefully, their hearts are sending distress signals that nobody taught them to recognize. 3 hours before a nighttime heart attack, your body whispers. But most people have been told those whispers are just aging, just indigestion, just stress. They are not. And the way you are sleeping right now could be silently multiplying your risk. What I am about to share with you has saved lives in my own clinic. Stay with me. Before we go further, I need you to know something about item number 1 on today's list. There is one specific sleep position so dangerous for your heart after 60 that a landmark study found it increases nighttime cardiac event risk by up to 47% in people with even mild, undiagnosed arterial stiffness. And almost nobody is talking about it. Not your doctor, not the evening news. You will know it before this video ends. I am Dr. Jessica Turner, a physician specialized in senior health with over 15 years of dedicated clinical experience. I have sat with thousands of men and women over 60, many of them after they survived a cardiac event they never saw coming. What they all said, almost word for word, was this: "Doctor, my body was telling me something. I just did not know how to listen." What I am about to share goes against the comfortable story we have been told about heart attacks. That they strike without warning, that they are unpredictable, that there is nothing you can do in the hours before. That is simply not true. The science says otherwise, and I refuse to stay silent any longer. If this information seems valuable, hit that like button right now, and let us begin. Here is what most people do not understand about nighttime heart attacks. They are not the same as daytime ones. After 60, your cardiovascular system undergoes a significant shift in how it regulates pressure, rhythm, and blood flow during the hours of sleep. Between 2 and 5 in the morning, your body enters what cardiologists call the circadian vulnerability window. Your blood pressure fluctuates, your heart rate dips, and then surges. Your blood becomes slightly more prone to clotting due to hormonal rhythms that evolved millions of years ago. And if your arteries are even partially stiffened, which they are in over 65% of adults over 60, that window becomes dangerous. A 2021 study published in the Journal of the American Medical Association found that nearly 38% of all fatal cardiac events in adults over 65 occur between midnight and 6 in the morning. 38%. That is not a small number. That is more than 1 in 3. And the terrifying part is this: many of those people felt something in the 3 to 4 hours before they went to sleep. A subtle pressure in the chest, a strange fatigue in the left arm, a jaw that felt tight for no reason, indigestion that did not respond to antacids. They dismissed every single signal. Here is what is happening inside your body during those final hours before a nighttime cardiac event. Your coronary arteries, the ones that feed the heart muscle itself, depend on a delicate balance of blood pressure and arterial flexibility to deliver oxygen-rich blood continuously. When that balance is disrupted, either by arterial plaque that has been building quietly for years, or by inflammation triggered by something as simple as a large late-evening meal, or by the wrong sleep position compressing major vascular pathways, the heart begins sending chemical distress signals. Cortisol spikes, adrenaline surges, and in a heart that is already working harder than it should, that combination can trigger the cascade that leads to a full cardiac event. And here is what terrifies me most. Most of the warning signs that appear in those final 3 hours are ones people have been trained to ignore, not because they are subtle, but because they look like ordinary evening discomfort. That is what we are going to change today. I have identified 7 warning signs your heart sends before a nighttime attack, ranked from the ones most commonly dismissed to the one that demands immediate attention. And I am going to tell you exactly how to sleep and what to do to reduce your risk dramatically. Starting tonight. Before we continue, I am curious. How old are you right now? If you are in your 60s, type 60 in the comments below. If you are in your 70s, type 70. If you have already crossed into your 80s and you are still here watching and learning, type 80 and know that I deeply respect that. Let us see how many of us are in this together. Sign number 7. Unusual fatigue in the left shoulder or upper arm appearing after 7 in the evening. This is one of the most universally dismissed warning signs, and it is dismissed for a very specific reason. After a full day of activity, nearly everyone over 60 experiences some degree of shoulder or arm fatigue. It feels explainable. You carried groceries, you worked in the garden, you reached for something on a high shelf, But there is a critical difference between muscular tiredness and ischemic referred pain, and learning to tell them apart could save your life. When the heart muscle is being starved of oxygen, even intermittently and mildly, it triggers a pain referral pattern through the phrenic nerve and the cervical and thoracic nerve roots. This pattern almost always travels toward the left shoulder, left upper arm, occasionally the left side of the jaw or the left ear. Unlike muscle fatigue, this discomfort does not respond to changing position. It does not get better when you sit down or stretch. It persists regardless of what you do with your body. It may come and go in waves, and it tends to worsen when you lie flat. A 2020 analysis published in Frontiers in Aging reviewed emergency records from adults over 65 who had experienced nighttime cardiac events and found that 61% had reported unexplained left arm or shoulder discomfort in the 6 hours prior. 61%, more than half, and in nearly every case, they had attributed it to something physical they had done that day. The pro tip here is simple but powerful. If you feel an unusual ache, heaviness, or numbness in your left arm or shoulder that begins after dinner and does not resolve when you rest, do not go to sleep without telling someone in your household. This is not a reason to panic, but it is a reason to stay awake and pay attention to what your body does next. Sign number 6, a sensation of fullness, bloating, or indigestion that does not improve with antacids. This one is responsible for more missed nighttime cardiac events than almost any other sign on this list. The reason is simple. The symptoms are genuinely indistinguishable from gastrointestinal discomfort to the untrained observer. Pressure in the upper abdomen, a sense of fullness that persists even hours after eating, nausea that comes and goes, a burning feeling that travels upward but does not quite behave like typical heartburn. Millions of Americans over 60 reach for an antacid and go to bed, and some of them never wake up. Here is the physiological explanation. The vagus nerve, which is the longest cranial nerve in your body, connects your heart directly to your digestive system. When the heart is under ischemic stress, the vagus nerve can trigger a cascade of gastrointestinal symptoms that perfectly mimic acid reflux and indigestion. This is why so many heart attack survivors describe feeling like they had bad stomach problems before the event, not chest pain. Research published in the Journal of Clinical Nutrition has shown that adults over 60 who experience recurring unexplained episodes of upper abdominal discomfort, particularly in the evening, have a statistically significant higher incidence of underlying coronary artery disease compared to age-matched controls without these symptoms. The distinguishing factor to watch for is this. Cardiac-related digestive discomfort tends to be accompanied by at least one other subtle sign on this list. It also does not improve with antacids, does not worsen with specific foods the way genuine reflux does, and often comes with a vague sense of unease that is hard to describe. Trust that sense of unease. Your body is not random. When something feels wrong in a way you cannot explain, listen to it. Sign number 5. Shortness of breath when lying flat, even without physical exertion. If you notice that lying down makes you feel slightly breathless, or that you need more pillows than you used to in order to sleep comfortably, please take this seriously. This phenomenon has a medical name. It is called orthopnea. And while it can have several causes, one of the primary ones in adults over 60 is early or progressive heart failure, which is itself a significant risk factor for nighttime cardiac events. Here is what is happening. When your heart is not pumping as efficiently as it should, fluid can begin to accumulate in the lungs. When you are upright, gravity keeps that fluid in the lower portions of the lungs and the lower extremities. But when you lie flat, that fluid redistributes. It presses against the airways, and breathing becomes harder. You might notice yourself waking in the middle of the night with a sudden gasp or feeling like you need to sit up to breathe properly. This is not normal aging. This is your heart telling you it is struggling. A 2022 study in the New England Journal of Medicine found that adults over 65 who reported needing 2 or more pillows to sleep comfortably, compared to their baseline from 5 years earlier, had a 43% higher risk of an acute cardiac event within the following 18 months compared to those with no such change. 43%. And the vast majority of those individuals had attributed the change to back pain or personal preference. Pro tip. Pay attention to changes from your baseline. If you used to sleep flat and now you cannot, that change matters. Do not normalize it. Mention it to your doctor at your next visit, and if you are experiencing it alongside any other signs on this list, do not wait for the next visit. Sign number 4. swelling in the ankles or feet that appears or worsens in the late afternoon and evening. Many people over 60 experience some degree of ankle swelling, and many of them have been told it is simply a consequence of aging or of being on their feet. In some cases, that is true. But there is an important pattern to watch for that separates benign dependent edema from cardiac edema, and the difference could save your life. Cardiac edema, the swelling caused by a heart that is not circulating blood efficiently, has a specific signature. It is bilateral, meaning it affects both ankles equally. It pits, meaning when you press your thumb into it and release, the indentation remains for several seconds. It worsens progressively over the course of the day, not just after standing. And it is often accompanied by a feeling of heaviness or tightness in the lower legs that does not fully resolve overnight. The mechanism here is fluid retention caused by reduced cardiac output. When your heart pumps less efficiently, blood backs up in the venous system. That increased venous pressure forces fluid out of the blood vessels and into the surrounding tissue, beginning at the lowest point in your body, your feet and ankles. Over time, this can progress upward. And when it reaches the lungs, the situation becomes critical. Research published in the Journal of Applied Physiology found that adults over 65 with progressive bilateral ankle edema had a 52% higher incidence of major adverse cardiac events within 2 years compared to those without edema, even when controlling for other cardiovascular risk factors. I want to share something that happened with a patient I will never forget. Her name was Patricia. She was 71 years old, a retired school teacher from Atlanta. She had been coming to my clinic for years, always cheerful, always convinced she was perfectly healthy because she had been active her whole life and had no history of heart disease in her family. For several months, she had noticed that her ankles were puffier by evening. She mentioned it almost in passing at an appointment, the way you mention something you have already decided is not important. She told me it was probably from standing all those years in the classroom and that it went away overnight. I asked her a few more questions. The swelling was in both ankles. It had been gradually worsening over the past few months. It was not there in the morning but was significant by evening. I ordered a cardiac workup. What came back showed she had significant early-stage heart failure, completely asymptomatic by any other measure. We adjusted her care plan immediately. 3 months later, she sat in my office and said, "Doctor, you probably saved my life by taking my swollen ankles seriously." I had convinced myself it was nothing. I think deep down I was scared to find out otherwise. This was not a dramatic rescue. This was prevention. This was a woman who listened to her body long enough for someone else to hear it too. And you can do the same thing. If you are finding this video helpful, please hit like and subscribe so you will not miss the simple tips we share every week. And now, let us move to the 3 most important warning signs. These are the ones that demand the most attention because they appear closest to the cardiac event itself. Sign number 3, a feeling of pressure, squeezing, or heaviness in the center of the chest that comes and goes during the evening. This is the warning sign that people most commonly recognize as potentially cardiac in origin. And yet, a startling number of adults over 60 still dismiss it, attributing it to anxiety, muscle tension, a heavy meal, or getting older. The phrase I hear most often in the clinic is, "It was not really pain, more like pressure." As if pressure that comes from the heart is somehow less serious than pain. Let me be very clear about something. The classic description of a heart attack, the crushing chest pain radiating down the left arm with sweating and shortness of breath, is a textbook presentation that accounts for less than 40% of actual cardiac events, particularly in adults over 65. The more common presentation, especially in older adults and in women, is subtler. It is pressure, heaviness, a sense of something sitting on your chest, tightness that comes and goes. These presentations are equally serious and are missed far more often. A study published in the Journal of the American Medical Association found that among adults over 65 who had experienced nighttime heart attacks, nearly 58% had reported episodic chest pressure or tightness in the 2 to 4 hours before the event. 58%. More than half, and a significant portion of them had taken an antacid or dismissed it as anxiety and gone to bed. The physiological mechanism is this. Angina, which is the medical term for chest pain or pressure caused by reduced blood flow to the heart, can be stable, meaning it appears predictably with exertion, or unstable, meaning it appears at rest or with increasing frequency. Unstable angina is a precursor to heart attack. When you experience chest pressure at rest in the evening while sitting quietly, that is not a benign signal. That is your heart telling you that its blood supply is compromised even at its most basic resting state. Pro tip: If you experience chest pressure or heaviness that lasts more than 5 minutes, or that goes away and comes back within the same evening, do not go to sleep. Sit up. Tell someone in your household. Call your doctor's after-hours line. And if it is accompanied by any other sign on this list, call emergency services. This is the one sign that should never be rationalized away. Sign number 2. Sudden cold sweating, clamminess, or a gray or pale complexion appearing in the evening with no obvious cause. When your body begins to redirect blood flow away from the skin and peripheral tissues in order to maintain circulation to the vital organs, particularly the heart and brain, the surface of your skin loses its warmth and color. You become pale, sometimes grayish. Your skin feels cold and damp. You may feel suddenly nauseous. This response is driven by the sympathetic nervous system, the same fight-or-flight mechanism that prepares your body to respond to a threat. In this case, the threat is internal. It is a heart muscle that is not receiving enough blood. This is one of the most reliable warning signs because it is not easily mimicked by other conditions. Genuine cardiac diaphoresis, the cold sweating associated with heart events, has a specific quality. It appears suddenly, often without any obvious trigger like physical exertion or a warm room. It is accompanied by a sense of doom or profound unease that many survivors describe as unlike anything they had felt before. And it does not resolve with cooling down or resting. It persists or worsens. Research from the New England Journal of Medicine analyzing adult cardiac event presentations found that cold diaphoresis occurring at rest, particularly in the evening, was present in 67% of adults over 65 who were subsequently diagnosed with acute myocardial infarction. 67%, 2 out of 3. This is not a rare or ambiguous signal. This is your body raising a red flag. I need to tell you about James. He was 74 years old, a retired firefighter from Chicago. He was one of the most stoic men I have ever had the privilege of treating. He came to my clinic not because he was worried about himself, but because his daughter had practically dragged him there. She had noticed something 3 evenings in a row. Her father, who was always warm and rugged, had been sitting in his armchair after dinner looking pale and clammy. He had waved her off every time, said it was nothing, said he was just tired. When he came in and described what had been happening, I immediately ordered an electrocardiogram and a series of urgent blood panels. What came back confirmed what I feared. He was in the early stages of an acute cardiac process. We got him to the hospital within hours. 2 weeks later, when he came back to see me, he said something I think about often. He told me, "Doctor, I have walked into burning buildings. I have never been scared of anything in my life. But when my daughter made me come here, something told me she was right to be scared. I am glad I listened. His daughter saved his life by paying attention. You can save your own by doing the same." Now we come to the number 1 warning sign, the one I mentioned at the beginning. The one that is most consistently present in the hours before a nighttime cardiac event and yet is almost never discussed outside of specialist cardiology settings. Sign number 1. A sudden, brief, intense sensation of your heart fluttering, skipping a beat, or beating irregularly, occurring at rest in the late evening. These are called palpitations. And before I explain why they matter so profoundly in this context, I need to address something directly. Not all palpitations are dangerous. Many adults over 60 experience occasional benign palpitations triggered by caffeine, dehydration, stress, or positional changes. Those are not what I am describing. What I am describing is this: a palpitation pattern that begins in the late evening, at rest, without an obvious trigger. That feels qualitatively different from anything you have experienced before. That may be accompanied by lightheadedness, brief dizziness, or a sudden feeling of weakness. And that keeps recurring across multiple evenings rather than being a single isolated event. After 60, the electrical conduction system of your heart becomes more vulnerable to disruption. The sinoatrial node, which is the heart's natural pacemaker, and the network of conductive tissue that coordinates the heartbeat across all 4 chambers, can be affected by arterial disease, inflammation, electrolyte imbalances, and the gradual structural changes that come with aging. When coronary artery disease begins to compromise blood flow to these tissues, the electrical system of the heart can begin to fire erratically. These misfirings manifest as palpitations, irregular beats, or brief pauses followed by a forceful beat. A landmark analysis published in the Journal of the American Medical Association tracked adults over 65 with evening palpitations occurring at rest and found that those with recurring episodes over 3 or more consecutive evenings had a 47% higher risk of experiencing a major adverse cardiac event within the following 30 days compared to age-matched controls. That is the statistic I mentioned at the very beginning of this video. 47%. Nearly half. And this was among people with no prior cardiac diagnosis. The mechanism is not mysterious. Palpitations at rest in this age group and in this pattern are often the surface manifestation of underlying ischemia, meaning the heart muscle is intermittently starved of the oxygen it needs, and the electrical system is responding to that deprivation by misfiring. This is the heart's final attempt to tell you that something is wrong before the situation escalates. Here is the pro tip. Keep a simple log. If you experience palpitations in the evening, note the time, the duration, and what you were doing. If it happens on 2 or more evenings in the same week, bring that log to your doctor. If it happens and is accompanied by chest pressure, cold sweating, or left arm heaviness, call emergency services. Do not wait. Do not lie down and hope it passes. This is your heart using every mechanism it has available to communicate with you. Now, before we continue with your sleep strategy, let me hear from you. Have you ever experienced any of these warning signs and dismissed them? Have you written off evening chest pressure as indigestion? Or waved away left arm heaviness as muscle fatigue? Type yes in the comments if any of this sounds familiar. If you are watching this and nothing on the list has ever happened to you, type never. Your response helps other viewers realize they are not alone. Now let us talk about sleep itself. Because how you sleep after 60 is not simply a matter of comfort, it is a matter of cardiac safety. And there are specific sleep positions and sleep habits that either reduce or dramatically increase your overnight cardiac risk. The most dangerous sleep position for your heart after 60 is sleeping flat on your back with no elevation, particularly if you have any degree of sleep apnea, which affects an estimated 30 to 40% of adults over 65, the majority of whom are undiagnosed. Here is why this matters so profoundly. When you sleep flat on your back, the soft tissues of the throat relax under gravity and can partially or fully obstruct the airway. Each time this happens and your brain rouses you just enough to breathe, your sympathetic nervous system triggers a surge of cortisol and adrenaline. Blood pressure spikes suddenly, heart rate surges. For a heart that is already managing arterial stiffness, plaque, or compromised blood flow, these repeated overnight pressure spikes are profoundly damaging. Over months and years, they accelerate the exact coronary disease process that leads to nighttime heart attacks. Research published in the Journal of Applied Physiology found that untreated sleep apnea increases the risk of fatal nighttime cardiac events in adults over 60 by up to 340%. 340%. And sleeping flat on your back is the position most likely to worsen apneic episodes, even in people who have never been formally diagnosed. The protective sleep strategy has 3 components. First, elevation. Sleep with your head and upper torso elevated between 30 and 45 degrees. This can be achieved with a wedge pillow, an adjustable bed base, or by elevating the head of your mattress. This elevation reduces apneic episodes, lowers fluid redistribution to the lungs, reduces blood pressure fluctuations overnight, and decreases the cardiac workload during the vulnerable early morning hours. Second, lateral positioning. Sleeping on your left side, specifically, has been shown in multiple studies to reduce nighttime blood pressure and improve cardiac output in adults with arterial stiffness. The left lateral position allows the heart to sit in a more mechanically efficient orientation within the pericardial space and reduces the compressive forces on the aorta and pulmonary vessels that occur in right lateral or supine positions. A 2023 study in Nutrients Journal found that adults over 65 who consistently slept in the left lateral elevated position reported 31% fewer nighttime awakenings associated with cardiac symptoms compared to those sleeping flat or in the right lateral position. Third, pre-sleep cardiac preparation. In the 2 hours before bed, avoid large meals, particularly high-fat and high-sodium meals, which trigger inflammatory responses and blood pressure increases that peak 2 to 3 hours after consumption, placing the cardiovascular system under maximum stress precisely when you are trying to sleep. Avoid alcohol, which disrupts sleep architecture and blunts the protective physiological dips in blood pressure that healthy sleep provides. Instead, the evidence supports a brief 10 to 15-minute evening walk, which reduces post-dinner inflammatory markers, lowers overnight blood pressure, and improves nighttime heart rate variability. Now let me share how all of this comes together in a practical plan you can start tonight. Here is exactly how to implement this, starting this evening. In the 2 hours before bed, eat your final meal no later than 2 hours before your intended sleep time. Keep the portion moderate. Focus on anti-inflammatory foods, leafy greens, omega-3 rich proteins, and complex carbohydrates that do not spike blood sugar. Avoid adding salt at the table. A brief 10 to 15-minute walk after dinner is one of the most evidence-supported cardiovascular protective habits you can build. At 1 hour before bed, check in with your body deliberately. Do you have any sensation of chest pressure or heaviness? Any unusual left arm or shoulder discomfort? Any palpitations? Give yourself 2 minutes of quiet attention, not anxious attention. Calm, observational attention. Your body communicates quietly. You need to be quiet enough to hear it. When you go to bed, position yourself in the left lateral position with your upper torso elevated between 30 and 45 degrees. If you use a single standard pillow and sleep flat, tonight is the night to change that. A simple wedge pillow is available at most pharmacies and is one of the most underutilized cardiovascular protective tools available to adults over 60. Within 3 days of sleeping in this position with proper elevation, most people notice a reduction in nighttime awakenings and an improvement in morning energy levels because the heart is working more efficiently through the night. Within 1 week, those who have been waking up feeling unrefreshed or with morning grogginess often begin to notice a meaningful difference as the overnight cardiac and respiratory efficiency improves. Within 2 weeks, blood pressure readings taken in the morning, which tend to reflect overnight cardiovascular strain, often begin to show improvement, particularly in adults who have been sleeping flat with undiagnosed or mild sleep apnea. Within a month, the cumulative effects of reduced overnight cardiac stress, reduced inflammatory load, and improved sleep architecture can translate to measurable improvements in daytime energy, morning blood pressure, and resting heart rate, the kinds of changes that will make your doctor take notice. Do not make these critical errors. First, do not dismiss evening warning signs as indigestion or tiredness simply because you have experienced them before. Familiarity does not equal safety. Second, do not wait for classic dramatic symptoms like crushing chest pain before taking action. The majority of nighttime cardiac events are preceded by subtle signs that fall outside the textbook description. Third, do not assume that because you have been fine for years, you will continue to be fine. Arterial disease is progressive and silent. It does not announce itself until it is ready to become a crisis. I want to tell you about one more patient before we close. Her name was Dorothy. She was 78 years old, a retired nurse from Minneapolis. She knew more about medicine than most of my patients. She had spent 35 years caring for others, and like so many caregivers, she had become profoundly skilled at dismissing her own symptoms. She had been having evening palpitations for 2 weeks. She had noticed them. She had mentally filed them under stress and moved on. It was her granddaughter who eventually said, "Grandma, you keep putting your hand on your chest in the evenings. You need to tell your doctor." Dorothy came to see me almost apologetically. She said, "I know this is probably nothing. I feel silly being here." I said, "Dorothy, you spent 35 years telling patients to listen to their bodies. What would you have told them if they came to you with these symptoms?" She was quiet for a moment. Then she said, "I would have told them to take it seriously. We ran a full cardiac workup. What we found required prompt intervention." 2 months later, Dorothy came back for a follow-up. She sat across from me and said, "I kept thinking I knew better because I was a nurse. But you cannot diagnose yourself through the fog of denial. You just cannot. You are not broken. The information you were given was broken. The story that nighttime heart attacks come without warning is broken. Your heart gives you time. It gives you signs. It gives you hours. What you do with those hours is in your hands. Here is my challenge to you. Tonight, when you get into bed, take 2 minutes to check in with your body before you close your eyes. Notice what is there. Adjust your position. Elevate your upper body. Sleep on your left side. And for the next 30 days, pay attention to the signs on this list. Do not catastrophize. Simply observe. Your heart has been trying to speak. Give it the quiet it needs to be heard. So to summarize what we covered today, we went through the 7 warning signs your heart sends in the hours before a nighttime cardiac event. Unusual left arm or shoulder fatigue in the evening. Evening indigestion or fullness that does not respond to antacids. Shortness of breath when lying flat. progressive ankle and foot swelling, episodic chest pressure or heaviness at rest, sudden cold sweating or pallor without cause, and recurring evening palpitations at rest, which is the single most predictive sign, carrying nearly a 47% elevated risk over a 30-day window. Each of these signs individually warrants attention. When two or more appear together in the same evening, the threshold for action drops significantly. We also covered the most protective sleep strategy available to you tonight: left lateral positioning with 30 to 45 degrees of upper torso elevation, dinner at least 2 hours before sleep, a brief post-dinner walk, and deliberate pre-sleep body awareness. My message today is not fear. It is not panic. My message is that you have more power in this situation than you have ever been told. The information you now carry is information that could one day make the difference between waking up tomorrow and not. Share this video. Your parents, your spouse, your closest friends, your adult children, they need this information. A single share could save a life. That is not an exaggeration. If this video helped you, smash that like button. Subscribe for more real health solutions designed for adults over 60. And in the comments right now, I want to hear from you. Which sign on today's list surprised you most? Or have you experienced one of these signs and not known what it meant until now? Tell me in the comments. I read every single one. Because remember, aging does not take away your heart's ability to warn you. It simply asks you to become quiet enough to listen. Take care of yourself.